Good afternoon, Prof. and colleagues. Myself, Yukai, and Nobuhle will be doing a presentation on the Office of Health Standards Compliance. Unfortunately, our colleague Felicia is on call and is unable to join us. So the Office of Health Standards Compliance, or also known as the OHSC, is an independent body that was established in terms of the National Health Amendment Act of 2013 to ensure that both public and private health establishments in South Africa comply with the required health standards, investigations, and appropriate action is taken regarding healthcare complaints. The body was created to protect and promote the safety of healthcare users. It is important to note that the OHSC focuses on the health establishment and not on the individual healthcare professional. The conduct of individual healthcare professionals will continue to be regulated by the Health Professions Council of South Africa. And just to clarify on the definition of a health establishment, as according to the OHSC, it's defined as a public or private institution, facility, building, or place or part thereof that is operated or designed to provide inpatient or outpatient treatment, diagnostic or therapeutic interventions, nursing, rehabilitation, palliation, and other health services. So just a background history on the OHSC. The National Health Amendment Act of 2013 envisioned that the office set up within the Department of Health would play a vital and dual role, that being to advise on how to improve quality of care, monitor and report on non-compliance with health standards. So detailed tools for measuring compliance with the national core standards were developed, and health establishments began to self-evaluate using these tools. However, as the office within the department was taking shape and generating national standards, broader health policies evolved, and it became more clear that there was a need for an independent board to certify health establishments in both private and public sectors. This was especially relevant in 2011 when the decision to introduce a system of the national health insurance was made, thus creating the NHI fund, which would purchase services from only certified healthcare providers operating under the OHSC. So we'll now just be discussing the organizational structure of the OHSC. So it begins with the Minister of Health, followed by the OHSC board, which will be discussed later on in the slides, and then the CEO, and lastly, the Office of the CEO. And I'm sure you can see on the diagram where it says the Ombudt. The Ombudt is a person appointed by the minister in consultation with the board of the Office of Health Standards Compliance, who reports directly to the minister. So the work of the OHSC is structured around the following 4 key principles. So firstly, complaints management and Office of the Health Ombudt, which aims to consider, investigate, and attend to complaints relating to non-compliance with prescribed norms and standards. Compliance, inspection, certification, and enforcement. This program manages the inspection of the health establishments to assess compliance with national health systems, norms, and standards. Their role is to certify health establishments as compliant or non-compliant with the prescribed norms and standards, and to take any enforcement on those health establishments that are non-compliant. Health standard design, analysis, and support. This provides a high level support to the mandate of the office in relation to research, development, and analysis of norms and standards, and it supports the establishment of communication networks with stakeholders. And lastly, the corporate services, which aims to provide the financial, human resources, IT, and administrative support necessary for the OHSC to deliver on its mandate.
Now looking at the OHSC board, which consists of the chairperson, the vice chairperson and the board members as seen on the screen. The board is the accounting authority of the office and is responsible for determining the policy of the OHSC and undertaking strategic planning for the functions of the office. So the act on the basis of specific expertise and experience in various areas of healthcare, the law, finance, economics, the private and the public sector health systems. So now looking at the functions of the OHSC, the first one is these functions are set out on the section 29 of the National Health Amendment Act, which states that the office must advise and review the norms and standards that are to be prescribed for the national health systems and the Minister of Health, recommend to the Minister of Health quality assurance and management system for the national health system, inspect and certify health establishments as either compliant or non-compliant with the prescribed norms and standards, and where appropriate, withdraw such certification, investigate complaints relating to breaches of the prescribed norms and standards, make recommendations for the intervention of health establishments at a national, provincial, municipal, and individual level to ensure compliance with the prescribed norms and standards, as well as publish information relating to the prescribed norms and standards through the media and where appropriate to a specific community. So the OHSC enforces health standards through monitoring by collecting key information, inspecting of the healthcare establishments, awarding certificates to healthcare establishments that meet the required standards, issuing notices to health establishments that do not meet required standards, and investigating and settling complaints from the public about substandard health services. The OHSC can take further action if a health establishment fails to abide by the health standards by recommending that disciplinary action be taken against individuals in charge of substandard health establishments, impose a fine on a healthcare establishment, refer the health establishment to prosecuting authority, and recommend to the Minister of Health that the establishment or section of it be closed temporarily or permanently. So using life ESIDIMENI to show how the health standards compliance conducted an investigation to protect and promote healthcare users. This was seen in 2015 and 2016 when 1,711 mental care health users were forcefully relocated from mental health facilities operated by the life ESIDIMENI to alternative facilities managed by multiple NGOs. This resulted in the death of 144 patients, the exposure of 1,418 others to torture, trauma, and poor health outcomes, and the unknown whereabouts of 44 patients. This occurred due to the termination of the life ESIDIMENI contract with the Department of Health, together with the under-facilitated and unlicensed NGOs. So the Minister of Health at the time appointed the first health ombud to conduct a thorough investigation, address complaints, and suggest recommendations through the 2018 Life ESIDIMENI arbitration. The health ombud, as noted in the organizational structure, is functionally located in the Office of the Health Standards Compliance. Okay, thank you. Apologies for the yellow discoloration on the screen.
No problem. Thank you very much. I think that what the Office of Health Standards Compliance is all about is to bring up, like you described, quality in the context of the NHI. I've just shared with you that that is quite an uphill battle, with the office only being able to provide guidance and point out challenges, and managers are battling to be able to provide that kind of improvement. So you all know that and see that every day, that even though clinics are supposedly okay or deemed okay, they're not. So what I think this little bit on the Office of Health Standards Compliance is useful for you to know is that in the NHI context, it is expected to accredit. So if you're going to be a practice that is wanting to contract with the NHI, the Office of Health Standards Compliance will require to accredit you. It's likely that there'll be sort of different approaches. They may not always be coming out to actually do an inspection. So I imagine they have great challenges, human resource wise, to be able to go across the country do that. So I think that for you, just keep an eye on whatever is going on in the Office of Health Standards Compliance in regards to accreditation standards for contracting. Please note the difference. The HPCSA is a licensing body. And if you're contracted for the NHI, they will have to say yes, okay, if they want to approve you as a facility that belongs to them. One more thing, the likelihood is that the Ideal Clinic manual will be the way in which you'll be judged. So if you are going into practice, look at that as a way to look at what sort of standards are probably expected. It might not be as rigorous as that, but have a look at it. Right, I don't know if there are any other comments, any questions? Nobody with any questions? Okay, who will go